Hi, my name is Lisa Herms. I'm an Associate Director of Real-World Research with Ontada. We're very pleased to present a couple of abstracts and posters at this year's ASH conference, one of them being a real-world study about the utilization and uptake of bispecific antibodies for the treatment of relapsed refractory multiple myeloma, specifically in the community oncology setting. So the first bispecifics were approved in October 2022, and there are now 3 therapies that are preferred treatment options for patients after at least 4 prior lines of therapy. But despite these treatments being available, there's really limited real-world data so far that looks at the actual uptake and experience with these therapies in the real world, and specifically in the community oncology setting, which is quite relevant because there are some clinical operational resource demands to ensure the safe administration of these therapies. So we were quite interested in looking at this experience. We did a retrospective observational cohort study using our iKnowMed electronic health records database. We looked at 564 patients receiving bispecifics or other treatments in 5th line plus. And we looked at just the utilization of bispecifics over time, what kind of drugs were being used, and then we did a very high-level comparison of the characteristics between those bispecific patients and the ones who did not receive bispecific antibodies. And we found that despite being approved just in October 2022, through the data cutoff, which was July 2024, there's a very rapid uptake, both in absolute numbers, but also proportionately in patients getting bispecifics as opposed to other kinds of therapy, which is really encouraging. And then we also looked at the characteristics of these patients, and we found that for the most part, they're pretty comparable, but the bispecific patients tended to be a little bit younger and had a little bit of a better performance status, which again is kind of expected as novel therapies kind of come out. As patient and provider experience grows with these therapies, we do expect this to shift over time. But it was an interesting signal for us to pick up on. And so we're quite encouraged that even in the community setting, with some challenges with the administration of these treatments, that it's being used and the utilization is increasing. And so we're excited to continue the research, looking to extend our follow-up period to increase our patient counts. We're looking to do some more specific comparison between the bispecific and non-bispecific patients, which will come with better sample size as well. So really understanding who's getting them and who's not getting them and why is really the ultimate question. So we're looking to understand that. Ultimately, we'd like to link it to outcomes as well. So not just, is it being used, but what's the experience and the outcomes of using these therapies. And then if we see any plateaus in utilization or, understanding any barriers that there might be to the uptake of this and the continued uptake of this in the community setting. We looked across the United States, a very large geographically diverse network of practices, and we saw good uptake there. I think one of the next steps is really digging into some of the social determinants of health to see if there are any disparities in access, potentially as well. You mentioned rural, urban settings is something that we're quite keen on looking at further. I think we just need a little bit more time for these therapies to take off. There's some infrastructure needs to be put in place at the practice level. Practices need to develop playbooks for administering these treatments as well. And all of that's going to take a little bit of time. So that's why I think we'll be able to uncover some of those as we extend the follow-up as well, because that's kind of one of the motivations of the research is to get at that exact question.